Nos encontramos en Estocolmo, en el Congreso Internacional de Epilepsia, y hablamos con uno de los especialistas en la materia, el doctor Arnaud Bilaben, el neurólogo del Hospital de Rennes. En un principio, ¿cómo podríamos definir la epilepsia?
And how can we define the epilepsy?
How can you find it?
Define it.
Define it.
Define.
It's
How can you
the repetition of seizures. That means that the basic mechanism is an excess of excitation in some place in the brain, and you have two kinds of epilepsies. The first is generalized epilepsies and focal epilepsies. Generalized epilepsies mean that in almost 1 second all the brain is involved in the seizure, and the patient will be amnestic of the seizure. And the focal epilepsy is just a part of the brain that is involved in the onset of the seizure. And since it's involved, it may also propagate to the rest of the brain. And we speak about focal epilepsies and focal epilepsies with focal seizures, and focal seizures with simple focal seizures if there is no alteration of the consciousness, and complex one if there is an alteration, and sometimes it may be secondary generalized. And it's the repetition of such seizures that defined the epilepsy. Or after the first seizure, if you have a high risk of relapse, it's also an epilepsy now.
Todavía son desconocidas las causas que provocan la
It's
epilepsia.
still unknown, the causes of epilepsy, still unknown.
The basic mechanism we don't know, that's true. But we know that every aggression of the brain may cause epilepsy. That could be a scar of head trauma, that could be, the main cause is stroke, for example, so it's a cicatrice, it's a scar too. And you have some genetic causes, you have some congenital causes, you have tumor. Everything in the brain may produce epilepsy, and it depends of your genetical background. In some patients it will, and in some patients the same lesion in the same place won't give epilepsy. But there is a genetical background too.
¿Por qué está afectando cada vez más a personas jóvenes?
Why it's affecting more to young people?
There are two main age of onset of epilepsy. Young people, surely because of the congenital causes and the genetical causes, and old people too. After the age of 60, it's the onset of epilepsy is quite current. It's many times occurring after the stroke age.
Se ha presentado en el Congreso los nuevos estudios del FAI-COMPA. Háblenos de este medicamento, del fármaco.
Can you speak a little bit, talk about the product, the drug that been presented today from eczema? You talk about it.
It's a new drug against epilepsy. We have several drugs against epilepsy, but despite these several drugs, we still have 30 to 40% of patients that have still epilepsy. That's the patient we call drug-resistant epilepsy. And that means that we need some more effective drugs. And as you have several causes of epilepsy, you have several mechanisms of epilepsy, neurochemical mechanism. We don't know this mechanism, but we know that there are several different mechanisms, and we need different medications. The advantage of FAI-COMPA is that it's the first one targeting the AMPA receptor. And we know that the AMPA receptor, the glutamate, is involved in epilepsy. Progress now is to have new targets for curing epilepsy. FAI-COMPA is one of these. And maybe in the future, the best will be to be preventive against epilepsy. Because we know that there are some situations where there is a big risk of epilepsy after. For example, in a young child, if you have febrile convulsion, special febrile convulsion, we know that it may lead to epilepsy 1 year, 2 years, 10 years later. And there is something happening in the brain between this febrile convulsion and the first seizure. And maybe we shall try to act during this epileptogenesis, before it will be epilepsy. Mm-hmm. And it's the same for stroke, for example. We know that there is a risk of epilepsy after stroke. And we know that there is a risk of epilepsy after big head trauma, for example. Mm-hmm. And so it may be possible to be preventive of this epilepsy. That could be the goal, the goal for the next research.
Future.
Pues gracias al doctor Arnaud Bilaben y que las investigaciones continúen.